In this presentation, we'll explore the often overlooked impact of sexually transmitted infections in older adults, a growing concern with serious health and social implications. This project is presented by Group 6 for Gerontological Nursing and End-of-Life Care.
Sexually transmitted infections, or STI, rates among older adults are dramatically rising, according to the U.S. Centers for Disease Control and Prevention, 2023. They often go undetected due to stigma, low screening rates, poor health literacy, and misconceptions that older adults are not sexually active. Penn Hollow, 2024, Smith et al., 2020. Age-related physiological and immune changes can exacerbate STI severity, while symptoms may be misattributed to other conditions or aging itself. Mix 2024, Van Epps et al. 2023. As the aging population increases, improving STI awareness, screening, and education is vital for prevention, timely treatment, quality of life, and equitable healthcare. Kaplan 2023, Penn Hollow 2024.
In our research, we found the following. The CDC reports a notable increase of STI rates among adults age 55 and up in the United States. From 2010 to 2023, there was an 806% increase in syphilis, a 707.8% increase in gonorrhea, and a 473.2% increase in chlamydia. Based on this data, this is an issue that continues to grow rapidly. Most recent data suggests that there were 19,211 cases of gonorrhea, there were 21,186 cases of chlamydia, and 4,836 cases of syphilis in this population in 2023. With the misconception that the aging population is not at risk, there are many factors that contribute to STIs in older adults. Biologically, postmenopausal changes, a weakened immune response, and increased life expectancy can explain STI prevalence. There's an underscreening and lackluster education for older adults in the healthcare system. This can lead to delayed diagnosis and treatment and the further spread of disease. There are also behavioral, cultural, and social reasons for the high rates of STIs in the geriatric population. We will further explore these factors.
Biological factors are known as biological characteristics of an organism. So the biological factors of STDs in older adults are diseases and infections entering into the body through small breaks within the skin. This can be in the penis, vagina, anus, mucosal surfaces. There are two different types of biological factors when it comes to STDs. You have your curable, which is gonorrhea, chlamydia, syphilis, and trichomonas. These are something where you go to the doctor, you get diagnosed, and they give you medication and it goes away. But then you also have treatable, known as HIV, herpes, and HPV. These are all ones that you are with the rest of your life and you are taking medications to suppress the symptoms of this disease.
Some of the behavioral factors associated with the increase in STDs in the older population include a decrease in condom use, an increase in sexual activity, a limited perception of risk, and an increased access to new partners. A few things that play into this are condom use is associated with pregnancy prevention, and with menopause, the use of condoms decline due to the association with pregnancy prevention rather than STDs. And then there's a few things that go into the increase in sexual activity, which include the advancements in treatment for erectile dysfunction. There's also been an increase in the older adult population remarrying and being in senior living communities, being around each other. And then with that, sometimes sexual activity will increase with age. And then a lot of older adults don't see themselves as being at risk, so they don't get tested. They don't engage in preventative behaviors. They don't discuss this with their doctor. They think this is more of a younger generation's problem instead of going into adulthood as well. And then the dating apps and social networks that exist have also led to an increase in access of new partners for all ages.
Healthy sexual activity has been linked to positive outcomes such as improved cardiovascular health, greater quality of life, and better self-esteem. Unfortunately, with older populations, because self-reporting of sexual activity decreases, education around safe sex also decreases, thus increasing the risk for STIs in older adults. Smith et al., 2020. While there is no specific tool for measuring STI knowledge in older adults, the Sexually Transmitted Disease Knowledge Questionnaire, or STD-KQ, a screening tool used in younger individuals, was found to be helpful in identifying gaps in knowledge in this population. One of the most important things to be aware of in discussing sexual activity with older populations is not to assume a certain knowledge base.
In a 2020 study, adults aged 65 to 94 completed an STD knowledge questionnaire on 2 separate days. They were asked to not discuss the questions or research answers in between testing. Similar data for both days indicated 2 main points. A, the questionnaire is a reliable means for measuring STI knowledge in older adults and could be a critical clinical resource. Secondly, with only 42 to 43% of correctly answered questions, there is a clear STI knowledge deficit in the aging population. STIs in older adults are often overlooked, yet they can lead to serious physical, cognitive, public health, social, and psychological consequences. STIs can increase the risk of cognitive decline and even dementia in older adults. They may also worsen chronic conditions like diabetes or cardiovascular disease. Because symptoms can mimic normal aging, diagnosis is often delayed, leading to more severe complications. Ongoing transmission among older adults can lead to localized outbreaks, especially in the group setting. This adds strain to healthcare systems. Underreporting and limited data make the issue harder to track and address effectively. STIs carry a strong stigma, especially among older adults. This can lead to embarrassment, anxiety, and reluctance to seek care. Mental health can suffer, placing them at risk for depression or general decline, and personal relationships may be strained due to trust and communication challenges. These findings impact our nursing practice. How can we help older adults manage their risk for STIs?
Some of the things we as nurses can do to help reduce the STDs in the older adult population is to first talk about it. Sexual health doesn't need to be something that's looked at in any certain way, so by discussing it, we can reduce that stigma. We also should include sexual history questions in our routine assessments. We also can collaborate with physicians, pharmacists, social workers to ensure that they get a holistic care on all their needs, including their sexual health. Some patients would need help finding clinics or community resources for the testing and vaccines, so we as nurses can help find that for them. And then, of course, we need to document all of our screenings, risk factors, and the education we provided, as well as schedule follow-ups and vaccines as they're needed.
The biggest thing that nurses can do for our patients is provide them with protection and advocate for them and for themselves. So we want to start by encouraging our patients to use protection, whether it's condoms, dental dams, finger condoms, internal female condoms. If our patients are unaware of what these things are or how they work, we can provide them with pamphlets and samples and demonstrations so that they can further protect themselves. We also want to encourage our patients to get tested. There are 2 different types of tests that you can get. One is a urinary test that is going to test for chlamydia, gonorrhea, and trich in males. Females can also get it via urine, or if they are symptomatic, they usually get a vaginal swab for that. Then there is the blood test that tests for HIV, syphilis, and hepatitis. We want to encourage all of our patients to know the difference, ask questions, as well as encourage them to get tested with any new partners or any new occurring symptoms that they get. Lastly, we want to encourage our patients to talk with us. We don't want to be judgmental to our patients. We want to allow them to feel like this is a safe space and they can tell us that they are having new partners, or if something in their life has happened where they feel like they need to get tested. This all needs to be done non judgmentally, so they feel like they can come to us in future reference. It's very important for us to educate our patients on using condoms and protecting themselves in the act, as well as getting tested with new partners. But it is also very important for us to educate our patients on the medications and vaccines. According to LaBelle in 2025, she wrote that hepatitis B is recommended for any adults with multiple sex partners. This, as nurses, we need to make sure that our patients are either up to date on, and if they're not, provide them with education on this vaccine. We also have now with PrEP, which is for HIV. It's a pre and post exposure prophylaxis. Our patients in this age population lived through the 80s HIV epidemic, and they aren't aware of new technology and scientific advances that we have now had, so we can educate them on those. There's also PEP, which, according to LaBelle in 2025, is 200 milligrams of doxycycline taken within 72 hours of sex for prevention of gonorrhea, syphilis, and chlamydia. We just need to make sure that our patients are educated on all of this, as well as using condoms and getting tested, as well as making sure that we have time to answer any of our patients' questions and concerns about all these medications. They're all new to them.
In conclusion, given the growing number of STIs in older individuals, STI prevention and education of the aging population is vital to nursing practice. It supports respective, holistic care and ensures that this growing population receives adequate sexual health care.